Diabetes therapy. If diagnosed as diabetes, what does it do? I think that there are more ideas with influence not taking place to a life of it immediately, just because it was diagnosed as diabetes. There may be no subjective symptoms, and it may seem whether it should live and it is as before. However, if sick management is not carried out exactly, complications about which previous spoke will happen. Therefore, I would like you to consider performing diabetic blood sugar management appropriately in the first. Moreover, high blood pressure, cholesterol, and neutral fat may become high, and a diabetic patient may raise the frequency of myocardial infarction or cerebral infarction if a diabetes for a long time. And the protein comes out in urine, and renal function worsens and becomes dialysis from renal insufficiency in many cases. Therefore, it is important to put a periodical inspection, etc. And to think that diabetic whole body control is required. It is thought that there are very many patients who are having overweight merged in case of 2-type diabetes. Therefore, when being diabetes now who are growing fat, I would like weight loss first of all by thinking the meal with sufficient balance. Although weight is not necessarily suddenly dropped, since rebound will be caused if weight is dropped much rapidly. I would like you to consider 0.5 or 1 kilogram of weight loss in 1 month, and dropping weight gradually. In that case, a body mass index, BMI, the number of 22 is proper weight. Where are their proper weight and ideal weight? Since ideal weight is calculated by multiplying the square of height by 22, this should be subsided within the limit of 22. If BMI is 25 or more, it is treated as sick. So, it is important overweight to put loss in quantity as much as possible. Furthermore, the kind of obese to be the problem recently. Metabolic syndrome is built-in fat type overweight. Built-in fat type overweight promotes arteriosclerosis, and the blood sugar level becomes high with high blood pressure and hyperlipemia. Since the risk of causing myocardial infarction and cerebral infarction will also become high if metabolic syndrome merges, we recommend you, for the total fat area of built-in more than 100 square centimeters, to decrease first the quantity positively. Next, there are complications of high blood pressure and hyperlipidemia. High blood pressure exists in 40% of diabetic patients. And it is said that the symptoms of hyperlipidemia are also shown to about 30% of diabetic patients. If it thinks as a factor, which is the thing to related, respectively, and promotes the atherosclerosis, this should not necessarily control only the blood sugar level, and I will regard it as it being necessary to manage high blood pressure, high cholesterol, high neutral fat, and overweight collectively. Systolic arterial pressure should be managed by less than 130, and diastolic blood pressure should be managed by less than 80. As for total cholesterol, less than 200 and LDL cholesterol, less than 150 HDL cholesterol, the good cholesterol more than 40, and the neutral fat less than 120 should manage for the purpose. If it becomes diabetes, it is shown again how it treats concretely. We recommend you strongly to give priority to and manage a meal before movement in the case of diabetes. Management of a meal is about 90% of a whole management, and management of movement is 10% of the whole management. You may think that diabetes treatment is influenced by a ratio of this level. Though a diabetic medicine is used or insulin is treated, if the control of meal and movement have not been performed, overweight is advanced rather and glycemic control never becomes good. In the case of a house, it will be shaky when the foundation is not putting in order. Please manage firmly the meal, movement, and weight which your foundations like it, and control diabetes. The foundations of the diabetic treatment are the dietary therapy to the last. The foundation of dietary therapy are taking the proper balance of ingestion, suitable energy, a nutrient, carbohydrate, protein, and lipid must be taken by proper distribution. It may consider an ideal that the meal content ratio of carbohydrate, protein, lipid are such for 60%, 25%, 15% of the whole. Furthermore, I would like you to make it to a rule eating 3 times at morning, noon, and night, 2 times a day meal. For example, morning and noon or morning and night will become a cause which disturbs control on the contrary, and may increase the amount of meals at each time. Based on that point, I want you to divide a suitable calorie for a meal equally 3 times a day exactly. The doctor and the dietitian are guiding the intake of a meal so that it may become thin gradually to the person of overweight. To certainly measure one's weight and to perform the management is desired. There are many the patients to whom diabetes control becomes good only by dietary therapy. Furthermore, in the case of high blood pressure and high cholesterol, salt restriction and dietary restriction of cholesterol are required. In the patient of high neutral fat, I also think that it is an important point that dietary restriction, such as sweet things, fruit, and alcohol restriction, are performed. In consideration of the patient's corpulence degree and height, it decides what kilocalorie is suitable for a day. 1,600 kilocalorie is required when height is 160 to 170 centimeters for male, and 1,400 kilocalorie is required when height is 150 to 160 centimeters for female generally. Energy distribution is carried out on the basis of this, and the contents of the meal are checked. I think that it is desirable to calculate suitably whether the balance of its meal is good after consulting with the dietitian, since food is divided in 6 groups: carbohydrate, fruit, protein, lipid, dairy products, seasoning. However, since alcohol was not contained in this energy, it would like the family doctor to check propriety of drinking about alcohol. An exercise for a diabetic. The diabetic does not have to do strong exercise. We recommend an easy aerobics for about 30 minutes, for example, walk 30 minutes, bicycle 30 minutes, underwater walking, and so on. In order to use muscles of the whole body, it is said that a walk is the most desirable. Since about 70% of the whole muscles are used, especially the walking with shake your arm is recommended. It is thought that the walk, which is a grade which a pulse goes up for a while to an extent that it gets out of breath a little, is desirable. Please consult with a family doctor for details. Since a person with a bad heart, a hypersensitive person, etc., may become other sick by exercising suddenly, please take care. The oral medicine for diabetic. The foundations of diabetes medical treatment are the amount, method of meals, and exercise cure. However, when not working, it is necessary to undergo the further advanced medical treatment. In that case, please think that a diabetic oral agent, an oral anti-diabetic, and insulin injection contribute to medical treatment. You must not take a medicine in large quantities from the beginning, but it's begun from a small quantity and increases quantity gradually. As for insulin injection, it is desirable for it to be cautious of hypoglycemia and to carry out according to conditions. Since the blood sugar level may fall too much in some oral medicine, SU agent, and insulin treatment. When hypoglycemia is caused, it is necessary to take in grape sugar promptly. Those who are taking medicine which raises hypoglycemia, those who are injecting the insulin, an incretin agent, and GLP-1 agent need to get glucose and always need to put into a pocket or a handbag. Since GLP-1 agent has come out in addition to the insulin, please check which injection is used. I think that insulin is well used to persons of type 1 diabetes and 2 type diabetes. Although I think that incretin is well used to persons of overweight these days, is used also to the person of 2-type diabetes. Even when you use which, please use it after consulting with a doctor on an advantage and side effects. Conclusion. In the case of diabetes, dietary therapy is the most important. A meal with sufficient balance which is not had for which a meal and overeating is desired. I base on dietary therapy and think that it is to the first foundation to treat diabetes naturally. The foundations of this dietary therapy, a doctor and a dietitian, the nurse, often being consulted with and depending on the case. I think that it is important that I have it checked whether it is appropriate to always take what meal, and it is a serious happening that I have the point whether balance has collapsed again, whether its meal is a meal as directed checked. If glycemic control is good, even if it is diabetes, you can lead a life which is not fundamentally different from a healthy person and hardly changes a life either. In fact, even if it is the patient of the diabetes of 100 years old, those who are living ordinarily now come. Considering that, even if it is diabetes, it is not sad, or it does not feel sad, or is not worried more than needed. However, you must not be optimistic. After undergoing various inspections, also including reflection of the life by self, I will often consult about the point the medical staff side, and it would like you to check an uncontrolled state. If diabetic control is putting in order, marriage, pregnancy, and childbirth are also possible and can also go to overseas like an ordinary person. After often consulting the doctor's side about drinking and smoking, I think if you check about the propriety of use, he does not forget to be influenced by better life throughout life of the diabetic.